Talk Live with Liz, sponsored by TriHealth.
Welcome back, everybody. Health Talk Live. We may be hours away, as we mentioned, from early use authorization of that Pfizer vaccine. So here through Zoom, what we know and what we don't about this vaccine. Dr. Stephen Blatt joining us from TriHealth. He is the medical director for infectious diseases. First, I have to ask you, I know your hospitals have been busy. How are you holding up, and are you overwhelmed at this time?
Well, we're very busy. The healthcare workers are getting tired, but we're holding up. We're not overwhelmed, but we're at capacity, as a lot of the hospitals are in the Cincinnati area. So we're just urging everyone out in the community, keep wearing your masks, keep a social distancing, and we'll try to reduce as many cases as we can.
Well, certainly then you must be thrilled to hear that we could be very close to emergency use authorization of at least the Pfizer vaccine. We got a 53-page report within the last 24 hours telling us about it. What do we know and what don't we know about it?
So the report really confirmed what we already knew, was that the vaccine is highly effective, about 95% effectiveness. Some of the new things that we've learned, however, is that the vaccine seems to be very effective in some subgroups of patients, like older people or people with chronic medical conditions. And we were concerned that maybe it wouldn't work as well in those, but it still seems to work quite well. So that's a great sign.
And certainly that's the at-risk population. Now, just this morning, we did hear in the UK, after starting to give it to mass numbers of people, that there were just a limited number of reports of people who had sort of severe allergic reactions. They're now warning people, perhaps, that if you are a person that gets those kind of reactions, to take a pause. What do we know about that?
Yeah, so all we know so far is that it sounds like 2 patients who have a history of severe allergic reactions did have some sort of allergic reaction to the vaccine. Some allergic reactions are expected, and perhaps they would be expected to be worse in people with a history of allergic reactions. And so the UK government has come out stating that patients who are known to have severe allergic reactions maybe should hold off on the vaccine for now. And that's all we know. We need a lot more information before we can make any general recommendations.
And so as we roll this out, are you concerned that we will hear about all kinds of things and it will sort of temper our desire to get this, what could be a critical vaccine?
Well, we know that a small percent of patients will have some fever, some will have muscle aches, some will have fatigue, and that's expected with any vaccine. So we hope that it doesn't dissuade patients from taking the vaccine, because it is highly effective. But I do think it's important that people be knowledgeable about what kind of side effects they might anticipate, and that they be, ready to deal with those should they happen. They're rare, but you need to be informed.
All right, final thing, will this get us to normal, and how long do you think that will take?
Well, it sounds like they're thinking that it'll take at least another 6 months before the majority of Americans can be vaccinated. So sometime in mid-2021, I would hope that we would be at what we call herd immunity, where the disease stops spreading within the community, and perhaps we can go back to something more of what we would consider normal.
And are people who have had the virus, are they supposed to get the vaccine?
Yes, so the CDC and the ACIP, which makes those recommendations, have recommended that if you've already had the disease, you should go ahead and get the vaccine, because it looks like vaccine immunity lasts longer than immunity from the natural infection. It's possible, though, that people who've already had the disease maybe should be prioritized a little bit later, because they're already somewhat immune to the disease for the time being.
Well, we are learning more every day. You've been a wonderful resource. Dr. Stephen Blatt, Medical Director for TriHealth with Infectious Diseases. Thank you for joining us today.
Thanks, Liz. Good to see you.
All right, we'd love to know what you're talking about today, coronavirus or anything else that's health related on your mind. You can shoot me an email, hit me up on Facebook. Twitter address is @LBonus1.